Hello, everybody, and thank you for joining me tonight. I apologize for the technical difficulties in the beginning. My name is Dr. Kasey Reesberg, and I'm a local chiropractor. You may be wondering why a chiropractor is giving this talk on ear infections. Well, I'm not here to sell you anything, but I am here to give you a different viewpoint on the matter of ear infections and antibiotics, and are they really safe and are they necessary for everyone? The info I'm sharing with you may save your life and the lives of your children too, so I take this matter very much to heart. My goal tonight is to make you aware of some facts about ear infections, and I'm sure most of you, if not all of you, know somebody who has suffered or is currently suffering from them. So let's get started. So we'll be taking you through the topics of what actually are ear infections, the antibiotics, facts on ear infections and how they should be safely treated naturally, and different alternatives that you can take for the ear infections. So what is an ear infection? Well, a middle ear infection, or otitis media, is actually an infection that occurs behind the eardrum and the middle part of the ear. Middle ear infection is the most commonly treated childhood disease by pediatricians. 75% of all the children have at least one middle ear infection before the age of 3, and over 50% before the age of 1. So as you can see, they're very, very common. Here's a little diagram of an ear. Right over here in the ear, right before the eardrum is the ear canal where you might place a Q-tip in. Here is the eardrum itself, or what we like to deem it as the tympanic membrane. It divides the ear canal with the middle ear. So here's the middle ear, and it also drains right here through the eustachian tube back behind your throat. So fluid that's built up in the middle ear, as you can see behind the eardrum, that is what causes that middle ear infection. Ear infections themselves usually begin as a cold. You may be asking, what are the symptoms of the middle ear infection? Well, as most of you already know, children will tell you, before an ear infection ever develops, your child is actually most likely to get symptoms of a cold. So sniffles, clear running mucus coming from their nose. They also can get nasal congestion, or some have a low-grade fever. Others, a sore throat is common. And as acetylene, a cough may develop as well. Signs and symptoms are pretty obvious. With infants, they may be a little harder because the child can't tell you themselves that they're having inner ear pain. So the inability to stop crying is actually the most reliable sign in babies. Restlessness, a fever from between 100 and 104 degrees is very common. Not being able to sleep soundly, and also tugging at the ear. And toddlers show a little bit different signs. They usually complain of an earache, but they still can wake up in the middle of the night and have that temperature that like we were talking about before. You may be asking why the inability to stop crying. Well, especially when lying down at night, the fluid can't drain out of that middle ear like we were discussing before in the picture. So then the child's going to feel that fullness, start screaming, and it's very, very uncomfortable. There's actually 3 different forms of the inner ear or the middle ear infection. The first one is acute. It comes on quickly and is temporary inflammation in the ear. The second one is recurrent and is the most common. It is middle ear infection that occurs repeatedly with periods in time where the ears return to normal. Now, research actually has shown that these ear infections are actually caused by the antibiotics that are used to treat the ear infections. And then there's also chronic and effusion ear infections, which is persistent inflammation where the fluid is trapped in that middle ear, but it's no longer painful to the child. But they can be just as dangerous. So like I said before, it's the most common diagnosis in sick children in the United States, and over 75% of of all children will experience one before the age of 3. That makes it over 7 million children each year get these ear infections. It's also one of the top 10 reasons for admittance into the emergency room, which made up 1.6 million visits in 2006 alone. 25 million office visits for under the age of 15 that accounts for. In estimations of cost, that costs us $3.5 billion just to actually treat the ear infection. When you take into the cost of the parents when they lose their wages, when they have to take time off work, then that estimated cost rounds up to $6 billion just to treat these ear infections. So there was a study done in 2009, and this study created this article saying the rise in antibiotic-resistant pediatric infections. The percentage of children's ear, nose, and throat infections caused by a type of dangerous drug-resistant bacteria has more than doubled nationwide. The increase has been described as alarming and is a cause for concern. The bacteria known as methicillin-resistant Staphylococcus aureus, or MRSA, can cause dangerous and even life-threatening invasive infections that do not respond to penicillin-based antibiotics. Doctors are concerned that MRSA is becoming resistant to other antibiotics as well. So while this is a strategy to treat ear infections, it's also coming back to bite us. Bacteria like the MRSA are eating the antibiotics for breakfast. So what are more people going to do? Well, I can tell you one thing, we need to break that cycle of round after round of antibiotics that just don't work. The experts are saying no too. As you can see from the CBS Health, an article came out from the American Academy of Pediatricians, saying that most children with ear infections, about 80%, will actually recover on their own. So the experts are saying no to them too. Why are we still prescribing them? In February 2008, according to the University Medical Center in the Netherlands, antibiotics are not associated with a significant reduction in fluid buildup. Okay, so let's take a second right here. If they don't actually significantly reduce the fluid buildup, as we explained before, the fluid buildup is the cause of the ear infections, then we're not actually addressing the cause with the antibiotics. They're not doing enough good for the children. According to the British Medical Journal, antibiotics did not decrease pain level within 24 hours, and they seem to have no influence whatsoever on additional attacks of the inner ear infections. Antibiotics were also associated with near doubling the risk of vomiting, diarrhea, and rashes. A study from JAMA, or the Journal of American Medical Association, said that amoxicillin is not effective in the treatment of persistent asymptomatic middle ear infections in infants and children. It concluded that children who took the drug for chronic ear infections were 2 to 6 times more likely to have a reoccurrence of the fluid buildup than those who just received a placebo sugar pill. So not only are they not helping, they're actually making these reoccur. How many of you knew that the antibiotics that you're giving your children actually increase your child's chance of getting them? Well, I'm sure none of you did, otherwise we wouldn't be giving them to our children. Also, according to the American Academy of Pediatricians, routine prescription of antibiotics for middle ear infection, you're treating 15 children to benefit 1. That means literally 15 children are going to go on antibiotics, but 1 will reap the benefits of them. Those are just not good statistics. The New York Times, there was an article published in 2009 as well that said an initial observation period of 48 to 72 hours is recommended for children to determine if the ear infection will resolve on its own without using the antibiotics. And most children actually do improve within those 72 hours. To sum up the May issue of Pediatrics in 2004, there's been new guidelines for the medical treatment of the middle ear infection. Watchful waiting for at least 3 months before recommending treatment is necessary because most of these inner ear infections will actually be treated amongst themselves and they will actually get better. Antihistamines and decongestants are also found to not be effective. Antibiotics and steroids are not recommended for routine management as well. And removing their adenoids should not be performed unless really specific reasons to do so. So I'm sure a lot of you, like myself, who've had their tonsils and adenoids removed as a child, little do we know that there's actually a special kind of white blood cell that actually fights bacteria that the adenoids and tonsils give back to their immune system. So they're actually important jobs in their immune health. Another study in 2005 surveyed parents and doctors on their use of perceptions. Results indicated that although medical guidelines recommended watchful waiting, few doctors actually regularly practice it. Parents who had a higher educational level, more knowledge about antibiotics, and greater involvement in medical decisions were more likely to be satisfied with a watchful waiting recommendation. So it is your informed choice as a parent to know this. So if few doctors regularly practice the new guidelines, why do you think they're doing so? Well, in actuality, there's been a lot of pressure from parents. No parent wants to see their child suffer through an ear infection, although they may be doing more harming than good with intervening with the antibiotics. Antibiotic prescriptions in the US, over a quarter of them are just for the middle ear infection, 24 million prescriptions each year. So, who does the World Health Organization blame? Sore throats and inner ear infections ailments, once easily treated, may soon become immune to antibiotics, such as malaria and tuberculosis have become in some countries, says the World Health Organization. Their annual report of infectious diseases says overcoming antimicrobial resistance paints a comprehensive picture of the dwindling effect of penicillin and other antibiotics have in fighting once simple bacterial infections. They said poorly planned or haphazardous use of medicines has caused drugs to lose their effectiveness almost as quickly as scientists have become able to discover them. Also, Newsweek in 1994. The Agency of Healthcare Policy and Research concluded there is no benefit from amoxicillin compared to a placebo and control group in preventing the inner ear infections. According to the University of Rochester Medical Center, experts have been arguing for years that pediatricians use or need to determine the type of bacteria causing an ear infection before throwing an antibiotic out of it. Most do not know, nor are the later generations of doctors required to learn. Actually, there's a strand, the 19A strain, which has become likely created a combination of the speed of bacterial evolution and the over-prescribing of antibiotics. So this 19A strain is actually resistant to 18 antibiotics, which are the ones approved by the FDA. So how many of you asked through a child, either as yourself or as a parent, if your child was allergic to penicillin the last time they went to a doctor? Well, how would you know unless they've actually taken it before? I say this because the fact is that all drugs have side effects. Each and every one of them do. And it's crucial to weigh the risks and benefits out before giving those drugs, especially to our children. It's important not only for you to be aware of the most common side effects, but actually all of the side effects, even the rare ones. And many people say, well, why the rare ones? Well, let me ask you a question. Even if the risk of getting a certain disease is 1 in a million, how many of your children are 1 in a million? Would you and should you take the risk with your child? I do want to share a little story with you. This little boy is Wyatt Lehman. I'm going to share a story. In 2008, Wyatt Reese Lehman, aka Pie Man, was a happy, healthy baby with a loving family and an adoring older brother. That all changed one day when he was diagnosed with a simple ear infection, and his mother, like any good mother, took him to prompt care to find out what was going on, and he was prescribed a prescription of amoxicillin. Shortly after taking amoxicillin, he actually became very severely agitated. The next day, he had diarrhea and began to break out in a head to rash toe. Wyatt was then admitted to the emergency room where he was found that he was in near complete liver failure. This little 9-month-old boy had just had amoxicillin for a simple ear infection. He was listed as status 1A, the highest level to receive a liver transplant, and was transferred to UCLA for the operation. He was just about to be airlifted to have the surgery, but unfortunately, time ran out. He died in the arms of his loving mom just 30 days after taking antibiotics for his ear infection. 30 days. So I ask you this. What do you think would have happened if Wyatt hadn't taken amoxicillin? Well, I think the answer is pretty obvious. What if Wyatt's parents would have been told that they had non-drug options? What if Wyatt had never had the ear infection in the first place? Well, I shared the story of little Wyatt Lehman not to upset you, but because Wyatt's parents have asked me to do so. And through their pain and loss, they've dedicated their lives to do whatever they can to assure that nobody else suffers like they have. I'm 110% committed to helping families like yours by telling the truth and sharing proven and safe alternatives to this common childhood issue. I'm also 110% committed to helping Corey and Trish get their message out and encourage you to visit WyattLehmanFoundation.org. It's a nonprofit organization that's dedicated in his honor. And here's a picture of him. So you may be wondering, okay, if antibiotics don't work, then what's the alternatives? Well, we could always put tubes in their ears, many people say. So inserting tubes, or in other words, tympanostomy or laryngotomy, they all mean the same thing, is actually when the doctor pokes a hole into the eardrum so the ears can drain. Tympanostomy tube insertion is the first surgical choice for surgical intervention. Approximately 20 to 50% of children who undergo this procedure may have otitis media relapse and actually require additional surgeries. Well, why would they need additional surgeries if you're actually taking care of the problem? Well, let me ask you, do you think that they're actually taking care of the problem or just masking a symptom? Kind of like to use this analogy of you see your check engine light start flashing in your car. Now, this light gets very annoying to you. You could simply cover it up with black electrical tape and say, hey, I don't see the light anymore. It's gone. Don't have to worry about it. But are you actually getting at the cause of why the light is going off in the first place? And what's going to happen if you continue to drive your car with that light flashing? Well, I can tell you it's going to seize and cost you thousands of dollars in damage. So we wouldn't want that to happen to your car. Also, we wouldn't want that to happen to your child. So according to the New York University School of Medicine, tube placement is the most common surgical procedure performed in 2003, largely because otitis media is the most common reason to be taken to a doctor's office. Each year, more than 500,000 tube surgeries are performed, and as many as 30% of children undergo the tube insertion need to undergo another procedure within 5 years, which costs on average over $2,000 per procedure. And another study that I recently read, the average was 4 to 5 times that the children's tubes could either fall out or need to be replaced. $10,000 just for tubes in their ears when they don't get at the underlying cause of the ear infection. According to Science Daily, use of ear tubes for tube infections not consistent with expert guidelines, study says. A new study suggests that children who typically receive an operation to insert ear tubes because of ear infections or fluid in the ear may not need it, according to the clinical practice guidelines. So, if no antibiotics, no tubes, then what? Well, a lot of people's answer, let's just give another vaccine for it. Welcome Prevnar vaccine. Prevnar, or the heptavalent pneumococcal conjugate vaccine, or the PCV7, is now available and can be given to younger children. It was approved by the FDA in 2000. It's supposed to protect against the 7 most common strains of pneumococcus or pneumonia. It is estimated that children with recurrent ear infections, which as we know, those are the most common, who are vaccinated will have a 10 to 20% lower chance of having recurrent ear infections. Just 10 to 20% chance. Those are not good statistics. The American Academy of Pediatricians does not recommend routine use in children who are only at moderate risk, including children from ages 2 to 3 and children 3 to 5 who attend daycare or who are Native American, Alaska Native, or African American descent. If these vaccines were so safe, then why would you not recommend them to all children? So is another vaccine really the answer? Though sold as ear infection preventative and tested as excruciating twisted manner to prove it does prevent the disease, reports have been coming out that showing that the Prevnar actually causes the ear infections. Worse, it's now a superbug. So like what we were talking about before with antibiotics, it's actually causing the ear infection, mutating, and getting stronger as a superbug. No good can come of this. Okay, it's a little physics lesson now. So the laws of cause and effect. Every cause has an effect, and reverse is the same. Every effect has a cause. So what is the cause of your child's ear infection? Well, here is a really good analogy for it. Take a swamp. If you have a swamp that is stagnant, like the one shown right here, not moving, and has hundreds of mosquitoes surrounding all of it. Now, in order to get rid of the mosquitoes, you could just simply spray the swamp. It would definitely kill the mosquitoes, but the swamp water itself, you can see, is still not moving. So what's going to happen? That's right, the mosquitoes are going to be coming back. You didn't actually take care of the cause of the swamp. Now, remember that ear that I showed you earlier? And I said to remember that the eustachian tube drains the fluid of the middle ear? Well, that's going to come back to play too. Just as the mosquitoes will always return to the swamp, bacteria and viruses are always going to return to that eustachian tube as long as that fluid is remaining there. So, what is going to be the treatment? We need to circulate the water, or in other words, we need to drain the fluid from the middle ear and cause it to no longer get stuck in the middle ear. So, surrounding that eustachian tube is actually a muscle, and this muscle is called the tensor veli palatini muscle. Here is a little biology lesson for you. Don't worry, there's not going to be a quiz on it. But this tensor veli palatini muscle actually controls the entire eustachian tube. How many of you guys ever had a stiff neck out there? Yes, they're pretty common. If it's on stiff neck, then it's a stiff back. I'm sure most of you have had. When you do have that stiff neck or back, are the muscles in there relaxed and calm, or are they rigid and spasming? That's right, they're probably rigid and spasming. Now, if this tensor veli palatini muscle is in spasm, how much fluid do you think is going to drain out of that tight, rigid muscle? That's right, none of it will. The fluid is actually going to build up and become stagnant in the middle ear, and it's going to trap that bacteria in there, which is the cause of the ear infection. Now, a little background about the muscle. It's innervated by the medial pterygoid, a branch of the mandibular nerve, third branch of the trigeminal nerve. Here's the biggest part. The actions is associated with both mastication, which is chewing, and the opening of the eustachian tube through tensing the palate. Okay, motor fibers can be traced from the tensor veli palatini muscle to the superior cervical sympathetic ganglion. The cervical plexus receive these fibers between the spinal levels of C1 through C4. Now you know that there's 7 cervical vertebrae, C1 through C7. So through those top 4, if you interrupt the communication with either C1, 2, 3, or 4, then this muscle is going to start going into spasm. And there's a very common condition called a subluxation that affects these levels and can be responsible for that muscle end up causing the ear infections later on. And this condition is called a subluxation. Now here's a picture of the side of your spine. You can see all the nerves running out through each one of the little holes right there. Now you can see the areas of the body parts and then possible symptoms that are shown from the picture as well. We're going to take a closer look at C4. You can see the areas of the body parts, nose, lips, mouth, and eustachian tube right there. That is being affected by C4 vertebra and the C4 nerve coming out of that vertebra. So when the nervous system is turned on, you do not have ear infections in that area. There was a study done comparing children of pediatricians and children of chiropractors. So 200 pediatricians and 200 chiropractors were selected and surveyed and determining the health status of their children. So the chiropractic children showed a 69% otitis media-free response, while the medical children only had a 20% otitis media-free response. 93% of all the episodes of otitis media improved under chiropractic care in 10 days and less, and 43% in just 2 visits. So remember the vaccine, that Prevnar vaccine that we were talking about before? What did that give as far as statistics go? I think it said something between 10 and 20% that it actually may help with. So this 93%, that 10% does not even come close to the results of subluxations. A study was done that says 80% of children have blocked nerve impulses in the upper neck area that can lower resistance and leave the child vulnerable to ears, nose, and throat infections. Structural changes cause muscle spasms and block the tubes that actually drain the middle ear. A chiropractic evaluation is of decisive importance, and chiropractic care can often bring about amazing, successful results and help reducing that. Some other home remedies that you can consider: warm compress or washcloth can be held over the ear for 5 to 10 minutes with an hour break in between. There's also essential oils that can help with ear infections. The ones that are recommended, tea tree oil can be rubbed on the outside of the ear and down the neck. Make sure you dilute this tea tree oil with a carrier oil, such as pure coconut or olive oil or the V6 oil. Lavender and Melrose or purification can also be used on the outside of the ear and down the neck. Thieves on the bottom of their feet can also help boost their immune system and help kill the infection. Once again, you make sure you dilute the thieves with a carrier oil. Oregano or mineral oil with a couple of drops in the ear canal can also be used to help treat and help get the earwax from building up as well. You have to be careful with the oregano or mineral oil if they are placed within the ear, because any damage to the actual eardrum could result in a lot of pain for the child. So please, if the child does have tubes in the ears, do not use any oil in their ears. Although they're not foolproof, here are also steps that can help prevent. Number 1, breastfeeding infants for at least 6 months. That will give the necessary antibiotics in order for them to help fight off infections. Serving your family, as well as your children, plenty of fruits and vegetables each day. Making sure your family gets proper rest at night, at least 7 to 10 hours for kids. Reducing the stress. Best way a kid can actually have their stress reduced is to see a parent reduce their stress. Avoid smoking. And assure optimal nerve function. Now, with that nerve function, you may be asking, why is that? Here's another picture of the signs. Okay, all the senses, you hear, see, touch, smell, taste, you do all those senses in the world through your nervous system. It's why it's referred to as the master of all systems of the body by Gray's Anatomy. It controls every other organ and system in the body. Isn't it funny that we've all had our heart and lungs checked by our doctors, but most don't actually check what controls them? The nervous system. Well, luckily, that's what chiropractors do. Chiropractors look at the nervous system. Here's another really interesting chart right up here. It's saying how the brain controls everything else in the body and how the communication is best. A subluxation actually comes before or a precursor to when somebody has a symptom. So before you have that achy back, before the child has an achy ear, they already have a subluxation going on. That leads to these symptoms. A really good analogy is to see plants here being watered by a water tower. Okay, as the life force goes through, you can see how these plants are surviving great up at the top because they are watered regularly by the plants. You can see right here in the second level, the one to the right is surviving great, but the one to the left is starting to droop a little bit, doesn't have its color. And then if you trace it back, oh, it's not getting its proper water supply. That's the cause behind it not surviving and thriving. Well, what happens when we pinch off all of that water supply? Look at the plants actually die. Without the life force, nothing can actually live. So without our nervous system, how do we expect our organs and every other system to survive? They can't. According to Ronald Perro, PhD, who was the chief of cancer prevention research at New York Preventative Medical Institute, he did a really interesting study. It's actually an immune competence test. And what he did was had 3 groups in the study. He took blood draws from every person in the 3 groups and threw some bacteria and viruses from them. He divided each person into one of the 3 groups. Group number 1, there's people who had been under regular chiropractic care for 2 or more years. There's people that were deemed chiropractic care, or not under chiropractic care, but were deemed healthy, meaning that they had good pulse, good heart rate, good vitals. And there's people who were sick, had cancer, and others that he was treating. The results of the study. The chiropractic patients had a 200% greater immune competence than those people who hadn't received the chiropractic care and were deemed healthy, and a 400% greater immune competence than those people with cancer and other serious diseases. Now, how many of you want a 200% greater immune competence and immunity? I'm sure most of you do. How many of you want to learn how to have a better immune system without the uses of drugs or surgeries? Well, chiropractors are actually the ones that are trained and skilled and talented enough to determine if your child is subluxated. We're fortunate enough to use great technology in the office too. This is a surface EMG scan. Each bar here represents a nerve. We look to see if all the bars are white and the shape and pattern and what the interferences are. So if there's an interference, the bar is going to appear greater in size, and it's going to either be green, blue, red. We also look at the shape, which, as I mentioned before, should be this nice pear shape. And we also want it symmetrical from side to side. So here is the normative scan. So this is what we want all of them to look like. Here is the initial scan of a child with chronic ear infections. So look at this scan. He obviously has a lot of color going on in this scan. You can see how dark these colors are, and you can see how wide the bars are. So that nice pear shape that was supposed to be going on is now distorted because of all of that muscle tension and subluxations in those areas. A lot of people are wondering, is chiropractic safe for children? Yes, chiropractic is very safe for children. We have very light techniques in the office, and they're very safe for people of all ages. So now let's take a look at this same person, but after 12 adjustments. After 12 adjustments, we like to rescan to see the improvement. And you can see those really dark, those heavy black bars that were going across right here. See how they're still red in appearance, so we've made some progress, but it's getting more to that normative shape, and there's a lot less stress on that nervous system now. Now let's take a look after 24 adjustments. Look. Much, much better. No red on the scan. Some severe change to moderate and mild, but once again, great progress. Which one of these children is going to have ear infections, and which one of these children is going to be able to run, jump, laugh and skip with their friends without having those ear problems. Obviously, the later ones. So you may be wondering what if my child has one of those subluxation things like was shown on one of the scans? Or maybe you're wondering about yourself as well. Well, here is your opportunity to find out. For all those who are with me tonight listening to the ear infection workshop, I'm giving you the chance to find out in our office. So with a $40 donation that we're going to donate back to the White Lehman Foundation, I will do a full spinal scan on your child and a full examination to determine if they have those subluxations going on and if we can help treat them and prevent those diseases from happening later on in life. I think it's definitely worth knowing if you can help prevent the diseases rather than taking care of them later on in life. Okay. So if you want to go online to mitchellfamilychiro.com, that is the website. I'm Dr. Kasey from Mitchell Family Chiropractic, or if you want to call the office at 309-828-6200, and we can make that appointment in order for your child or yourself or both to get checked out and determine if we can help you become subluxation free. So once again, it's Dr. Kasey from Mitchell Family Chiropractic at 309-828-6200. You can also email me at Dr. Kasey, so DrKasey at mitchellfamilychiro.com, mitchellfamilychiro.com. If anybody else has any questions, I will still be here. If not, thank you so much for joining.